StatCup is an easy-to-use, fully integrated on-site urine drug testing device. New and innovative, StatCup provides quick and accurate results. In this video, you will learn and observe the advantages of the StatCup, how to store and administer the test, how to interpret test results, how to document test results, and what to do when confirmation is needed for preliminary positive test results. Advantages of the StatCup. StatCup's integrated design means there is no risk of urine exposure to the test administrator. The test requires no activation, only a collection and interpretation of results. StatCup's flat face allows the administrator to photocopy test results for record keeping. Transportation is also simplified for those tests that need confirmation for preliminary positive results. StatCup offers the broadest range of drug and alcohol testing available in an on-site urine testing device. The StatCup is also available with the following optional tests: alcohol and adulteration strips, which indicate for specific gravity, oxidants, and pH. Additional adulteration options are available upon request. StatCup packaging, storage, and components. StatCup tests are packaged in boxes of 25. Each box also includes an instruction card, package insert, adulteration color chart, and security seals. Each StatCup is packaged in a sterile, sealed foil pouch and labeled with a product part number, the drugs and alcohol to be tested for, an expiration date, and a production lot number. Each StatCup includes an integrated collection cup and drug test device, a screw-top lid, and a liquid crystal temperature strip to verify specimen validity. Each test has a window where result lines will appear. StatCup tests include the following labels: a quick reference results key, space to enter the donor's ID number and the date on the cap and front of the cup, a gradient volume scale, and a minimum fill level line. A removable perforated label is also provided with each StatCup and is meant for the use of the test administrator. Each test strip on the StatCup is labeled with the abbreviation of the test substance. To properly store StatCup tests, keep them at room temperature. Do not expose tests to hot or freezing temperatures for a prolonged period of time. Adhere strictly to the expiration date on the foil pouch, and do not use tests beyond that date. Do not open the sealed foil pouch unless testing will immediately follow. Administering the StatCup. It is recommended that any personnel collecting and testing urine specimens be properly trained in urine drug screen collection procedures. In order to collect an acceptable urine specimen, closely follow these proper testing procedures. Strict collection procedures have been developed as a means to protect against improper handling claims, prevent the tampering or adulteration of the sample, and protect the donor against mistakes. For more information about this process, contact your service provider. Step 1. When you are ready to administer the StatCup, select a device and verify that it has a valid expiration date. Once the pouch is opened, label the testing device with the donor's ID number and the testing date. Instruct the donor to supply the minimum specimen volume required, as marked on the cup. Then give the StatCup to the donor and direct him or her to the restroom. Step 2. Once in the restroom, the donor should fill the cup to the minimum fill line. Screw the lid on tightly and return it to the test administrator immediately. Make sure that the donor and the specimen are never separated to ensure the proper chain of custody during the testing process. Step 3 is optional and depends on your company's policy. Depending on your company's policy, the provided temporary security seals may be applied at this time. Fill in the applicable information on the seal, then have the donor initial the seal before placing it over the lid with the sides folded over the edges of the StatCup. Step 4. To ensure that the urine collected is valid and has not been tampered with, use the following validity checks: specimen temperature, visual inspection, and the indications from the optional adulteration strips offered with StatCup. Verifying the StatCup specimen. Specimen temperature indicates a valid donor specimen. Check the temperature strip on the StatCup within 4 minutes of receiving the specimen. The temperature should register between 90 and 100 degrees. The strip will turn green to indicate the specimen temperature. If the specimen does not register as valid, stop the testing process immediately. Do not interpret the results and proceed with your company's policy for invalid specimens. Specimen validity may also be determined through a visual inspection. Closely examine the donor's StatCup. Check that the minimum volume has been provided. Also inspect for any odd odors, colors, or appearance of the specimen. If the visual inspection yields abnormal results, stop the testing process and proceed according to your company's policy. The optional adulteration strips offered with the StatCup should be used immediately and then interpreted within 3 to 5 minutes of the test administrator receiving the specimen. Refer to the enclosed color chart to interpret the specimen accurately. Compare colors to determine if the specimen is valid. Proceed with testing if the specimen is normal. Stop testing if the specimen is interpreted as invalid. Interpreting the StatCup results. After you have determined that the specimen is valid, peel off the blue label to observe the test as it begins to run. You should notice a pinkish color migrating up the test strips. Negative results may be interpreted as soon as they appear. Allow 5 minutes to pass before interpreting preliminary positive results. All test results are stable for 1 hour. To interpret the results of the test, look at the test result window. There will be a control region at the top of each strip and a test region at the bottom of each strip. A red line should appear in the control region to indicate the test has run properly. Interpret the presence or absence of a line in the test region to determine if a drug has been detected. Negative results for the StatCup specimen will appear as 2 lines in the testing window, one in the control region and one in the test region. Any line appearing in the test region, regardless of color intensity, should be interpreted as a negative result. After the designated 5-minute wait period, you may observe and note any preliminary positive results. A red line should appear for each substance indicated in the control region. If a second line of any color intensity does not appear in the test region, interpret this as a preliminary positive result. This means that the drug concentration in the specimen is higher than the detectable level. Remember, all positive results should be considered preliminary and should be confirmed by an alternative method. In the event that a red line does not appear in the control region, the test may be invalid. This may occur when an insufficient amount of urine has been collected. If this occurs, discard the test, review the process, and administer the test again. If the problem persists, contact your service provider immediately. If only one of the red control lines does not appear, try tilting the device toward the invalid strip and tapping the bottom of the StatCup lightly on the desk to aid the flow of the specimen and break up any air bubbles. If this does not help the line appear, the test is invalid. If this occurs, open a new package and pour the original specimen into a new StatCup. Documenting the StatCup results. When you are ready to document the test results, a 2-part electronic version of the preliminary result form is available upon request. Complete the applicable information, then remove the window from the form. Place it face down on the copier with the flat face of the StatCup in the window, and make a copy. If lab confirmation is needed for preliminary positive results, the urine specimen may be shipped to the laboratory of your choice inside the StatCup for a clean and efficient process. Check with your lab or service provider for instructions regarding chain of custody forms, security seals, shipping supplies, and additional training. Procedures will vary based on the individual lab. Disposing of the StatCup specimen. When it is time to dispose of the StatCup specimen, instruct the donor to take the StatCup back to the restroom, remove the lid, pour the remaining specimen into the toilet, and flush it. The lid should be returned to the device, and the device should be discarded in the trash can. For more information or technical support, call 866-933-0964 or visit our website www.micro-distributing.com.